And honestly, asking questions make you stand out, sound confident, but it does the most important thing that we all want, which is protecting your nursing license. Hey guys, and welcome back. For those of you who are new here, my name is D'Amber. I'm 28 years old. I am a registered nurse. I'm also in school to get my master's. My primary specialty, we'll say. So my primary specialty is med-surg. I've worked pediatrics, med-surg. I've done oncology, and right now I just switched over to the soft life, aka the PACU. And when I say I absolutely love it, literally love it. So I do want to tell you guys, thank you so much for your likes, your shares, your subscribes, your comments. All of that means a lot to me, and they don't go unnoticed. Life has been a little busy lately, so I haven't been able to get back to my comments as quick as I would like, but I always do comment back. So with that being said, let's get into today's video. So today's topic is 10 questions to ask in your nursing interview. A lot of people go to these interviews and they don't ask questions, or they don't know exactly what to ask, but I cannot harp on it. It is so important to ask questions, because just as much as they're interviewing you to see if you're a good fit for their unit, you also need to interview them to see if they're a good fit for your life, your unit, or for your life, your standards, and your mental health. So don't be afraid to go in there and ask questions. And honestly, asking questions make you stand out, sound confident, but it does the most important thing that we all want, which is protecting your nursing license. I literally talk about protecting your nursing license in every video that I make, because it is literally so important, and nobody cares about your nursing license except for you. So I promise, if you ask these questions, you will be able to protect those licenses prior to choosing the career that you want, or not the career, but the specialty that you want. Question number 1. So you will ask them, what does a nurse in this role look like after 6 months? And that right there opens up a door, because it's going to tell you what that unit is looking for, how that unit operates. And it also shows that you are interested in growing as a nurse, and you don't want to just come there and to just be, you know, an extra set of hands, or whatever you want to call it. So that question is really important. That will show you, that will honestly tell you, do they work off speed? Do they care about getting patients in and out? Do they have teamwork? What else would it show you? It'll show you, like, do they value independence? Do they have leadership? Like, that question really will give you a lot of insight on a unit in general. Question number 2 is literally my favorite question, because I have to know. I feel like we all want to know this too. What is your nurse to patient ratio? Like, I've been places where I've taken 5, 6 patients. I've even taken 7 patients one day, and the charting system was down. So we had a paper chart on all 7 patients. It was a whole lot. So honestly, asking what is this nurse to patient ratio will literally allow you to understand, oh, I can have 4 patients, or we go up to 5 if I need to. Or everybody starts out with 5, and then we can get up to 6, but 6 is the absolute max of what that unit will allow. That question is so important, because that could literally make or break your decision. Like, I don't want to work anywhere that has 6 patients where I can get possibly 7, or I don't want to have more than 5 patients. So that question, I promise you, is my favorite question. Is super important to me, because I need to know my workflow. Like, can I handle this? Is really the biggest thing. Like, can I handle having 6 patients? Can I handle having 5? So make sure you ask in those nursing interviews, what is the nurse to patient ratio? Also, when you're asking what is the nurse to patient ratio, don't forget to ask about day shift versus night shift, because some places are more staffed on nights to where the night shift ratio may be lower, and some places are more staffed on days to where the day shift ratio might be lower. So ask for days and nights. That way you can get a better feel for what it is. And don't accept vague answers like, oh, it depends, or because once it starts saying like, oh, it depends, that means that the number is probably really high. So ask for a number like, I can only take max 5 patients, you know, so make sure you get that out of them as well. All right, guys, question number 3, which is super important to me, and I know it's important to a lot of you guys because we all have a life outside of nursing. So this one is, how is scheduling handled? Most places that I've been have allowed you to self-schedule. Very seldomly have I been places where you don't. So when you ask how is it handled, make sure to ask about holiday requirements. Make sure you ask about weekends. If you're PRN, if you're part-time, make sure you ask those. Also, be sure to ask like how far in advance is the schedule out. Most jobs that I've worked put their schedules out 6 weeks in advance. So you kind of have to know, you know, 6 weeks, what do I need off? Like, what can I do? And then a lot of jobs that I've also worked too, for day shift, they make you work 1 or 2 Mondays, a scheduled period, and 1 or 2 Fridays. And for night shift, they make you work 1 or 2 Sundays and 1 or 2 Thursdays. So that's been very common as well. So make sure you ask those questions too. Question number 4, super important as well. Ask how that unit handles short staffing. Short staffs or nursing units become short staffed all the time. So now you want to know, like, will there be a charge nurse that steps in? Will nurses get floated to you guys? Do management become more active when that unit is short staffed? Or are the nurses who are there that day, are they required to take more patients? So it kind of ties back into that nurse to patient ratio question. But it's just good for you to know, like, hey, you know, if you're looking on the schedule and you're like, we're short staffed today, we're down a nurse. Now you know either the charge nurse is going to take an assignment or you're going to have to go up a patient. But that's really important to know because you want to be able to prepare yourself mentally before you walk into work when you guys are short staffed. And honestly, when you ask that question, that will literally tell you everything you need to know about management. Because if they don't say, like, you know, once we're short staffed, management is on the floor giving out, you know, extra set of hands, doing everything we can to help the unit run smoothly, that right there is really your answer. Question number 5 that I always like to ask is, what does my orientation process look like? I'm personally an experienced nurse, so mine would be a little bit different than a new grad. Most new grad nurses get 3 months of a training or orientation, whatever you want to call it, and then they allow them to go on their own. But a lot of places will tell you too, like, hey, after your 3 months, if you still don't feel comfortable, we can extend your orientation. But they won't extend it like for a very long time. At that point, they may have to have a conversation with you and tell you that they don't think you're a good fit for that unit if you're still not confident after, you know, 3 or 4 months of orientation to go out there on your own. For me, being experienced, I like to know because I don't necessarily need 12 weeks of orientation unless I'm going to the ICU or a very critical care unit. But like, I've worked med surg or, you know, stuff like that. So I kind of grasp onto things quicker. Or for example, I'm in the PACU now. So with my PACU, I'm only on orientation for 2 weeks or for 2 months. And honestly, most of that orientation is me just learning charting because their charting system is different from what I'm used to. But as far as the workflow of the PACU, I've already feel like I've grasped that. So just make sure that you ask how your orientation process will go. That way you can determine like, hey, I will be in orientation for this long. Also, make sure you ask them how many different preceptors you'll have in orientation. A lot of places like to switch up preceptors because they say that it gives new people the ability to see how everybody does things differently, which is fair, which is fine. But it can also be a little frustrating at the same time too, because one preceptor can tell you how to do something and you're doing it that way. And then you get to another preceptor and you're still doing it the way from the last one. And they're like, that's not how that's done. So also, you know, if you're the type of person that doesn't like, you know, 2, 3, 4, 5 preceptors, maybe this would be your chance to let them know like, hey, you know, I prefer just one preceptor. It's just easier on me mentally. So make sure you ask how long orientation would be, how many preceptors you'll have, and what the whole orientation process looks like. Because some places make you go to class as well while in orientation. Question number 6 that I love to ask, what are some challenges that are on the unit right now? Honestly, if they say that the unit has no challenges, that's absolutely not true. Because if they didn't have any challenges, they probably wouldn't be looking out to hire because everybody loves their job, which we all know how that is in nursing. So if they are very honest and very open with you about it, that's a very much a green flag. And you know, it gives you something to think about as well. Like, they're honest with me in the interview process. That way I have the ability to make the appropriate decision based off of these challenges. You don't want to walk into a unit that's on fire, they can't keep their staff, that everybody has an attitude, there's mean girls, mean guys. Like, you don't want that. So honestly, asking that question in advance, like what the challenges are, really opens up another door to determine if this, you know, unit is good for you. So for question number 7, you should ask them what opportunities there are for professional growth. So if you have a plan to go back to school to be an MP, if you want your master's in nursing, regardless if it's MP, if you want to become a charge nurse one day, or even in leadership, or you want to have some type of leadership role on the unit, this is a great question to ask, because they will tell you pretty much in the interview what's available, how to get there, and what you need to do. So, you know, ask those questions. See if you can be supported. See if they'll pay for you to go back to school to get your master's. See if they'll pay for you to get your certifications that you want and need. So make sure you guys ask that question as well. Question number 8 is, make sure you ask leadership how do they handle the unit when you guys have a lot of high acuity patients. I cannot tell you how many times, like, I've been on a unit where the whole unit has been like high acuity, and only like maybe 10 patients have been like on the lower side. Most of the times on those units, I've had management step in and actually help, because they understand. Or, you know, they'll fight back. Like, they'll tell the nursing soup, like, hey, this is what's going on our unit. We need some type of help. Like, we can't do this. We need another nurse. We need another tech, or whatever. Or sometimes, like I've said earlier, management will step in and get their hands dirty with you. So that's actually a really important question, because that'll determine, like, you know, are they gonna fight for us, or are they gonna just let us sit here and burn up while these patients are like super high in acuity, and, like, you know, we're just trying our best. So make sure you guys ask that question as well. I like to ask this question because I just want to know, but like, why do nurses want to stay on the unit? Like, that right there reveals the culture. Because if they're saying, oh, you know, they like the teamwork, they like, you know, each other, they all hang out, they have book groups, whatever, you know, fun committee, whatever. That right there will literally reveal a lot about the unit and about the culture and about the things that they're trying to do on that unit. Now, if they hesitate, we got something to look into, because why are you hesitating? But most of the time it reveals like itself. Like I've said plenty of times, people will literally let it be known when you walk on the unit, oh, this is a dumpster fire unit. Or they'll tell you, I'm only still here because of my coworkers. So like, honestly, it's something you'll figure out once you get on the unit, but it is still a very good question to ask management just in the interview. It lets you know, like, do you know your staff? Like, are you aware of what's going on the floor too? So that kind of opens up that door as well. And question number 10 that I like to ask is, what will make somebody not succeed in this role? This one will open up any hidden agendas. It'll kind of tell you like some common mistakes that have happened on the unit. It just kind of prepares you too, like, oh, okay, well, if I accept this job, I need to make sure that I'm doing X, Y, and Z, so I'm, you know, avoiding what he said or what they said in the interview about nurses that don't succeed. So yes, with that being said, those are all 10 of my interview questions that I like to ask personally. Like I said, the interviews are not just about the hospital, you know, inquiring you. It's about you also choosing to work at that hospital on that unit with those other coworkers. Also, one more question you can ask too, and let me not forget this, ask to shadow. Like, when your interview is over, just say, hey, you know, if you guys want to move forward, can I set up a date to shadow? Honestly, I shadowed a majority of my jobs, and that's how I was able to determine, like, you know, oh, okay, I kind of see how things are going, or I don't know if I'm gonna like this. So yeah, make sure you guys ask to shadow as well. But thank you guys so much for watching this video. Make sure you guys do share, subscribe, and like. Don't forget to add those comments as well. Good luck with everything, and I will see you guys next week with another video. Thank you guys. Bye.